You think you're eating healthy, yogurt, granola, probiotics. But what if I told you your gut could already be breaking down, silently? Not in years, not someday, right now. And here's the part most people miss. Your gut doesn't fail suddenly. It warns you first. Subtle signals. Easy to ignore. But in some cases, they can show up years before something serious even gets diagnosed. In this video, I'll show you what those signals actually look like, what new research is revealing, and how to reset your gut starting tonight. Quick question. Was your last meal more colorful or beige? Let me show you what that actually looks like. You open the fridge, reach for a yogurt that promises live cultures, and imagine you're doing something good. Now imagine those microbes have nowhere to act because the neighborhood they lived in, the lining of your gut, has been stripped bare. That's not hyperbole. Right now, your gut may be quietly sending early warning signs that something more serious could develop if left ignored. Today, I'll show you why those subtle signals matter, what the newest 2026 research is actually telling us about the gut and cancer treatment, and a practical 5-step reset you can begin safely tonight. Plus, we'll do 2 quick self-checks during this video so you can see where you stand. First, if this is landing with you, comment now with one word describing yesterday's biggest meal. Colorful or beige. Hit like and subscribe if you want the full 5-step reset at the end. Let me start with the easiest way to picture the gut microbiome. Think of it as a living pharmacy inside you. Trillions of bacteria and other microbes sit along your intestinal tract. They manufacture vitamins, produce short-chain fatty acids like butyrate, and make chemical precursors that your brain and immune system use every day. They don't just digest food, they send signals. Some of those signals tell your brain you're full. Others keep your gut lining sealed. When the pharmacy runs smoothly, you get balanced appetite, steady energy, and a calm immune system. When it's broken, you get cravings, inflammation, fatigue, and, over the long haul, an internal environment that can favor disease. One single biochemical pathway illustrates this clearly. Dietary fiber reaches the colon and serves as fuel for specific bacteria. As these bacteria ferment fiber, they produce butyrate, a short-chain fatty acid. Butyrate does 2 crucial things. It feeds the cells that line your colon, keeping the barrier robust, and it stimulates release of a hormone called GLP-1, which helps reduce appetite and stabilizes blood sugar. In plain language, fiber feeds helpful bacteria. Those bacteria make a molecule that flips the I'm full switch and helps keep your gut wall healthy. Take away the fiber, swap it for ultra-processed, beige convenience foods, and that pathway gets weaker. Less butyrate, less GLP-1, more hunger, more compulsive eating. There's also a fast signaling system you don't feel directly, but it controls how your gut talks to your brain. Specialized intestinal cells, sometimes called neuropods, can transmit information in milliseconds. When the microbial signals are off, when beneficial bacteria are depleted, the messages your gut sends to your brain can change from "I'm satisfied" to "keep eating." That's why many people describe stubborn cravings even after they think they've eaten enough. Now, the physical integrity of the gut matters too. The innermost layer that protects you from microbes and toxins is a mucus barrier, the house walls of your intestines. A healthy microbiome helps maintain that mucus. But with dysbiosis, an imbalance caused by a low-fiber, ultra-processed diet, certain bacteria begin to chew through that mucus for survival. Imagine rodents gnawing the walls of your house. Tiny gaps form. Those microscopic breaches allow bacterial components, molecules that don't belong in the bloodstream, to leak out. Your immune system notices and responds. That immune activation becomes chronic inflammation. Chronic inflammation is not just discomfort. Over time, it creates a permissive biological environment. More cell turnover, more oxidative stress, and a higher likelihood that mutated cells will survive and proliferate. That's a critical distinction. Dysbiosis and chronic inflammation don't directly cause cancer in a single step, the way a smoking exposure might dramatically increase lung cancer risk. Rather, they create conditions, an environment, where cellular damage and poor immune surveillance increase the probability of cancer developing or progressing. Think of it as tilting the soil toward weeds. The seeds may already be there. This is why early silent signals from your gut, persistent bloating, chronic fatigue, joint aches, new food intolerances, or even a recurring white coating on your tongue, shouldn't be dismissed as normal. That bridge from biology to clinical relevance is where the 2026 research is starting to get interesting. Several small clinical trials have asked a provocative question. Can shifting the microbiome improve responses to cancer therapies, especially immunotherapy? Early 2026 reports published in Nature Medicine looked at experimental microbiome modulation in the context of immunotherapy for solid tumors. 3 trials deserve attention, with one major caveat. These were small, often early phase or experimental studies done under strict clinical oversight. They are not standard care. The first trial, called FMT Luminate, enrolled 20 patients who had cancers that were not responding to checkpoint inhibitors. In this early phase cohort, clinicians administered donor-derived microbiota delivered in capsules. Around 8 of those 20 patients experienced an objective tumor response or durable clinical benefit that had not been seen prior to the intervention. That's encouraging, but remember the sample size. 20 patients in a carefully controlled research setting is not the same as widespread clinical proof. Results suggest a possible signal, not a guarantee. A second study, Perform, worked with a slightly different cohort, about 15 patients, with a focus on safety and immune markers. Researchers saw changes in immune cell profiles and reductions in some inflammatory cytokines following microbiota transfer, along with symptomatic improvements in fatigue and appetite in a subset of participants. Again, small numbers, exploratory endpoints. Perform shows feasibility and plausible mechanisms rather than definitive outcomes. The third study, Tacito, was notable because it was randomized and placebo-controlled, rare for this area, but still small and early. Tacito randomized roughly 80 patients and reported a difference in median progression-free survival between the experimental group and placebo, about 24 months versus 9 months follow-up on average, favoring the intervention group. That sounds dramatic, and it is promising, but the investigators explicitly cautioned about the small size and specific enrollment criteria. Tacito's results require replication in larger, multi-center trials before we call this a reliable clinical tool. Across these studies, the pattern you see is consistent. Experimental microbiome modulation can shift immune markers and, in some small cohorts, improve response to immunotherapy. But the limits are obvious: small sample sizes, early phase designs, strict donor screening, and interventions performed under physician supervision. None of these trials establish microbiome therapy as standard oncologic care yet. They suggest a hopeful direction and underscore the biological plausibility that a healthier gut could improve treatment response or reduce toxicity, but they do not guarantee outcomes for individual patients. That brings me to 2 critical safety points you must not skip. Do not stop, alter, or delay any cancer treatment without direct instruction from your oncologist. And do not attempt do-it-yourself fecal microbiota transplantation at home. These are biological procedures that can carry real risks: pathogens, infections, or harmful immune reactions. And in the trials I described, they were done in controlled clinical settings. If you or a loved one is interested in microbiome modulation as a complement to cancer care, raise the question with your oncology team. Ask whether there are clinical trials you might be eligible for. So what can you safely do now to support your gut, reduce inflammation, and potentially improve metabolic and immune resilience? Below is a practical, evidence-aligned 5-step gut reset you can start this week. These are low-risk, food and behavior-focused habits, not medical interventions, and they're designed to change your gut environment within weeks to months. Step 1. Aim for 30 plants per week. Plant here is broad: vegetables, fruits, nuts, seeds, herbs, legumes, whole grains, and even diverse teas count. A simple counting strategy. If you have 2 different vegetables at dinner, that's 2 plants. An apple is 1, a handful of almonds is 1. The goal is variety, because different plants feed different microbial species. Over 1 to 3 weeks, you'll begin to see shifts in stool consistency and hunger cues as fiber-fermenting bacteria rebound. Step 2. Add fermented foods daily. Options include plain yogurt, low added sugar, kefir, sauerkraut, kimchi, miso, or tempeh. These foods introduce live microbes and support diversity. Start with a small portion, 1 to 2 tablespoons or half a cup depending on the food, and monitor tolerance. If you're on immune-suppressing cancer therapy, check with your physician before adding raw fermented foods. In some cases, pasteurized or controlled options are safer. Step 3. Try a 12-hour overnight eating window. If you finish dinner by 7 p.m., wait until 7 a.m. to eat breakfast. This is not extreme fasting. It's simply ensuring your gut has a predictable fasting period to help circadian rhythms and microbial recovery. Many studies show measurable microbiome shifts in a matter of weeks with time-restricted eating. If you have diabetes or are on glucose-affecting medications, coordinate this with your clinician. Step 4. Cut back on one ultra-processed item per week. Don't try to overhaul everything at once. Choose one swap. Replace packaged sugary cereal with steel-cut oats plus berries. Trade a packaged snack bar for fresh fruit and a handful of nuts. Swap a microwavable meal for a quick grain bowl with beans and roasted vegetables. Small sustained swaps add up and reduce exposure to additives and emulsifiers that can disrupt gut bacteria. Step 5. Eat the rainbow every day. Aim to include at least 3 different colored plant foods at one meal: reds, greens, purples, oranges. Phytochemicals in different colors feed different microbes and have complementary antioxidant effects. Over time, this diversity supports more robust production of beneficial compounds like butyrate. Timelines to expect. Some markers shift in a matter of days to weeks. Hunger cues, stool frequency, minor symptoms. More durable changes in diversity and inflammatory markers often appear in about 3 weeks to a few months, depending on how consistently you apply the steps. The clinical trials I mentioned also saw immune changes within weeks in some participants, but remember those were controlled settings, with additional monitoring. Now let's do the second interactive check I promised. I want you to look in a mirror or at your phone and stick out your tongue. Is there a noticeable white coating, or is the surface relatively pink and clean? If you see a white coat that doesn't brush away easily, comment below with the words, "white coat." If your tongue looks clean, comment, "clean tongue." These are not diagnoses. They are quick visual cues that, combined with other symptoms, might suggest oral or gut microbial shifts worth mentioning to your clinician. A couple of practical notes about these self-checks. Plate color visualization and tongue coating are simple engagement tools that help you notice patterns. They are not substitutes for clinical testing like stool analysis, blood work, or colonoscopy when indicated. If you have persistent GI bleeding, unintentional weight loss, or severe new symptoms, seek immediate medical evaluation. Let's address some likely questions head-on. Will changing my diet prevent cancer? We can't promise prevention for any one person. What we do know is that chronic inflammation and metabolic stress increase risk over time. Improving diet, reducing ultra-processed foods, increasing fiber and plant diversity, and normalizing body weight can lower some of those risk factors. Will taking probiotics cure dysbiosis? Not necessarily. Over-the-counter probiotic strains can be helpful for certain conditions, but they are not a cure-all. Often the most powerful lever is food diversity, the substrate you give your resident microbes. What about the microbiome trials and their hype? They are promising and scientifically fascinating. They open a pathway where the microbiome could become an adjuvant to cancer treatment. But caution is essential. The trials were small, experimental, and done under close supervision. It will take time and larger studies to determine which patients might benefit, which donor profiles are optimal, and how to standardize these interventions safely. Before I close, a few safety reiterations that matter. Do not attempt fecal microbiota transfer at home. If you're interested in experimental microbiome therapies, ask your oncology team whether any clinical trials are available and appropriate. Never stop or change prescribed cancer treatments without a clinician's guidance. If you have an autoimmune condition, are pregnant, or are on immune suppressive meds, check with your doctor before introducing raw fermented foods or major diet changes. Here are 3 simple things you can do this week to start moving in the right direction. Add 1 extra colorful vegetable to dinner tonight, swap 1 ultra-processed snack for a whole food alternative, and set a goal to log how many distinct plants you eat across the next 7 days. Small, consistent choices compound biologically. To wrap up, your gut is an early signal center. Subtle signs, persistent cravings, a pale beige diet, chronic bloating, unexplained fatigue, or changes in the mouth can reflect a disrupted microbiome and low-grade inflammation. That inflammation doesn't promise cancer, but it makes the internal environment more permissive to malignant processes over time. Emerging 2026 research published in Nature Medicine suggests microbiome modulation can influence immune response in small experimental cohorts. FMT Luminate, 20 patients. Perform, 15 patients. And Tacito, randomized, 80 patients with median follow-up differences suggested at roughly 24 versus 9 months. But these results are preliminary and not standard therapy. The most reliable immediate steps are practical. Diversify plants, include fermented foods, try a 12-hour overnight fast, reduce ultra-processed foods gradually, and eat the rainbow. If this message resonated, Tell me in the comments right now, was yesterday's plate colorful or beige? Later, tell me white coat or clean tongue after you check your mirror. If you want a deeper dive, I've linked 2 videos you'll find helpful. One on how environmental chemicals travel from food to brain, and another that reviews evidence on food additives and cancer risk. And most important, if you're concerned about symptoms or your cancer risk, talk to your primary care doctor or oncologist. Nothing in this video replaces medical evaluation. Thanks for staying with me. Start small this week. Add a plant, skip one ultra-processed item, and notice how your hunger and energy respond. Small choices add up, your gut responds quickly, and early attention now may change your health down the road. If you found this useful, subscribe and check those 2 linked videos next. I'll see you there.